If you're over 60 and you're alone when chest pain hits, what you do in the next 60 seconds could save your life. Most seniors won't make it to the hospital if they don't know these steps. And I need you to hear every word of this. I'm glad you're here. Let me ask you something. If you felt crushing pressure in your chest right now and you were home alone, would you know exactly what to do? Would you call 911 first? Would you sit down or lie down? Would you know which moves could keep you alive long enough for help to arrive? If you're not 100% sure, type "me" in the comments, because what I'm about to share could be the difference between seeing your grandkids tomorrow or not. Here's what most people don't realize. Nearly half of all heart attack deaths happen before the person ever reaches the hospital. Not because the attack was too severe, but because they waited. They hesitated. They didn't know the simple actions that keep blood flowing when it matters most. I've seen this firsthand. Patients who could have survived if they'd just done one or two things differently in those first few minutes at home. Now, this isn't about fear. This is about preparation. Because there are real, proven steps you can take right now, even if you're completely alone, that can double your chances of making it through. These aren't gimmicks. This is what cardiologists teach their own families. And after today, you'll know them too. The American Heart Association backs every single one of these. And I've listed all the studies in the description if you want to dig deeper. But first, tell me in the comments, how old are you? I read every response. This is a conversation, not a lecture. All right, let's start with the most critical step. The one that decides everything else. Call for help immediately. Don't wait it out. The very first thing you need to do when you feel those symptoms, crushing chest pressure, sudden shortness of breath, that cold sweat, unexplained nausea, is pick up the phone and call 911. Right away. Don't tell yourself it's probably just indigestion. Don't wait to see if it passes. Don't worry about bothering anyone. Every minute you wait, more heart muscle dies. Cardiologists have a saying, time is muscle. The longer blood flow is blocked, the less chance you have of walking out of that hospital. Studies show that people who call within the first 5 to 10 minutes have survival odds up to 50% higher than those who delay. Yet nearly 1/3 of seniors wait more than 2 hours before seeking help, often because they don't want to make a fuss. I remember a 68-year-old grandfather in Ohio who felt that strange pressure in his chest. He told himself it was probably gas, drank some water, sat down to rest. He waited for hours. By the time his daughter found him and called 911, the damage was irreversible. His doctors said if he'd called right away, he might have survived with minimal heart damage. That story repeats itself thousands of times every year, and it breaks my heart every time. So please, if you ever feel those signs, act as if it is a heart attack until proven otherwise. Even if it turns out to be nothing, you've lost nothing. But if it is a heart attack, you've just taken the most important step to save your own life. Now, while you're waiting for help to arrive, there's something else you can do that can keep the damage from spreading. Chew an aspirin if you have one and you're not allergic. Once you've made that call, reach for an aspirin. Not swallow it whole, chew it. Aspirin is a powerful clot fighter. Heart attacks happen when a clot blocks blood flow to your heart. Aspirin thins the blood and stops that clot from growing, keeping some flow moving until paramedics get there. Research shows that taking aspirin during a heart attack reduces the risk of death by 23%. But speed matters. Swallowing it whole can take 10 to 12 minutes to work. Chewing it gets it into your bloodstream in just minutes. A 70-year-old retired bus driver was alone in his living room when he felt that crushing pressure. He remembered his doctor's advice. grabbed the aspirin and chewed it while waiting for 911. Paramedics told him later that simple action kept his blood flowing just enough to prevent major damage. He walked out of the hospital 2 weeks later, still independent. Now, if you're allergic to aspirin or your doctor told you not to take it, skip this step. For everyone else, keep a bottle of uncoated aspirin somewhere easy to reach. Doctors usually recommend one full 325 milligram tablet, chewed at the first sign of trouble. Think of it as buying yourself time. It won't cure the heart attack, but it can slow the damage until help arrives. But surviving alone isn't just about what you take. It's also about how you position your body in those critical minutes. Loosen tight clothing and sit upright. When a heart attack hits, every movement affects how hard your heart has to work. One of the simplest things you can do is loosen any tight clothing, belts, waistbands, collars, and sit upright. Tight clothes compress your blood vessels and make it harder for oxygen-rich blood to circulate. Sitting upright takes pressure off your lungs and makes breathing easier, which lowers the workload on your already struggling heart. Lying flat forces your heart to work harder, especially if you have weak lungs or conditions like COPD. By sitting upright, preferably at a slight angle with your back supported, you improve airflow and help blood flow more effectively. A 74-year-old woman in Florida felt chest pressure while gardening. Instead of lying down, she moved to a chair, loosened her apron and waistband, and sat upright while waiting for the ambulance. Her doctor later told her that decision likely kept her from fainting before paramedics could give her oxygen. It's such a small adjustment, but it gives your heart room to breathe. And in those desperate minutes, that can mean everything. Now here's something that sounds strange, but it saved lives. Cough strongly if you feel faint. If you start feeling dizzy, like you're about to pass out, try this. Cough. Deep and forceful, like you're trying to clear your lungs. It's called cough CPR. When you cough hard, your chest muscles contract and pressure builds inside your chest. That pressure forces blood out of your heart and into your brain, keeping you conscious when circulation is collapsing. It's not a cure, but it can buy you valuable seconds if you feel like you're going to faint before help arrives. Research shows that repeated strong coughing during heart problems kept patients conscious and maintained blood pressure until emergency treatment could begin. In some cases, people stayed alert for several minutes just by coughing every 2 to 3 seconds. A 69-year-old retired mechanic in Texas felt a sudden wave of dizziness during a massive heart attack. Alone in his workshop, he remembered hearing about this. He started coughing forcefully, again and again, and stayed conscious until paramedics arrived. Doctors said those coughs likely prevented him from collapsing and suffering brain damage. If you ever feel your vision narrowing, your head spinning, or your body going weak during chest pain, take a deep breath and cough hard. Repeat every 2 to 3 seconds until help arrives. It's like manually keeping your heart pumping when it's struggling. Now, here's something practical that too many people overlook. Unlock your door and keep your phone nearby. Every second counts. Not just for your body, but for the people trying to save you. If paramedics have to break down a locked door, you're losing precious minutes. Studies show that for every 10 minutes of delay in treatment, survival rates drop by nearly 10%. Imagine losing those minutes just because help couldn't reach you. A 73-year-old man in Arizona called 911 after severe chest pain, but collapsed before he could unlock his door. Paramedics had to force their way in. By the time they reached him, too much damage had been done. Compare that to an 80-year-old woman in Florida who unlocked her door, kept her phone in her hand, and stayed in a chair by the entryway. Paramedics got in immediately, started treatment, and she survived with only minor damage. Always keep your phone within arm's reach, especially if you live alone. Too many seniors leave it charging in another room. During a heart attack, even a few steps can cause collapse. Your phone is your lifeline. Your unlocked door is the bridge that gets help to you faster. Together, they eliminate barriers you can't afford. Now let's talk about staying calm, because panic can be just as dangerous as the attack itself. Take slow, deep breaths. When fear takes over, your body releases stress hormones like adrenaline. This raises your heart rate and blood pressure, making your struggling heart work even harder. One of the most powerful things you can do is breathe, slowly, deeply. Deep breathing does two things. First, it increases oxygen reaching your blood and brain. Second, it signals your nervous system to calm down, lowering the surge of hormones that strain your heart. A 76-year-old retired nurse from Michigan survived her heart attack by focusing only on her breathing. As the pressure in her chest grew, she sat upright, closed her eyes, and began inhaling slowly through her nose, exhaling even slower through her mouth. By the time help arrived, she was weak but conscious. Her doctor told her that those steady breaths likely kept oxygen moving to her brain long enough for treatment to begin. Here's how to do it. Place a hand on your stomach. Breathe in through your nose, feeling your belly rise. Then exhale gently through pursed lips, like you're blowing through a straw. Aim for about 6 to 8 breaths per minute. Slow, controlled, deliberate. Think of each breath as buying yourself more time. Time for oxygen to reach your brain, time for your heart to ease its load, and time for help to arrive. And finally, the most important survival rule of all. Stay as calm and still as possible. Your first instinct might be to move, to pace, to try and walk it off. But that instinct can be deadly. Every step, every sudden movement forces your weakened heart to pump harder, and during a heart attack, it's already fighting for its life. By keeping your body still and calm, you reduce the strain, conserve oxygen, and give yourself the best chance of surviving. Research shows that minimizing movement during a heart attack reduces complications and improves outcomes. In plain terms, people who stayed calm and still lived longer than those who moved around in panic. A 71-year-old farmer in Nebraska felt crushing pressure while working. His first thought was to climb a ladder to grab his phone. Instead, he forced himself to stay put and called for help from where he was. Paramedics told him that staying still kept his heart from collapsing under stress. He survived with far less damage than expected. Tell yourself, I've called for help. My only job now is to stay still and breathe. Think of your heart like a fragile engine running on fumes. Every movement revs it faster and risks blowing it apart. Stillness and calm are the keys to buying time. So those are the steps. Call 911 immediately. Chew an aspirin if you can. Loosen your clothes and sit upright. Cough if you feel faint. Unlock your door and keep your phone close. Take slow, deep breaths and stay as calm and still as possible. Each one buys you minutes, and those minutes can mean the difference between life and death. Now, I want to hear from you. Where are you watching from? And do you keep aspirin ready in your home? Drop your answer in the comments. I read every single one. If this gave you even a little peace of mind, hit that like button. It helps other seniors like you find this. And subscribe, so you don't have to search for me again. I post videos like this every week, and they're all designed to keep you safer, stronger, and more independent. Your strongest years aren't behind you, they're waiting for you, one smart choice at a time. Stay safe, stay prepared. I'll see you in the next video.